We're here with Dr. Syed Hussain from Trinity Health of New England, talking about a lot of medical headlines that maybe you guys are talking about and wondering, so we're getting some answers here. First off, we're talking about a new report from the CDC. The life expectancy has gone up, so it has gone up by more than a year. It's now at 77 and a half, but initially people might think, oh, that's great news. But it's really not, right?
No, that's right, Erica. Actually, this has wiped out where we are in terms of life expectancy in the U.S. Because of the pandemic, it wiped out 20 years of progress. So we're still not back to where we were, basically, to pre-pandemic levels. We're inching higher, which is great. And most of this is driven by a fall in COVID-19 mortality. So COVID-19, for instance, in 2021 was the third leading cause of death in the U.S.
Right.
It impacted 1.1 million people who died as a result. In the following years, it's gone down. This year, even though we still have a month left, it's probably going to be 9th or 10th leading cause of death. So it shows we've made progress. But there are other also buckets that we need to discuss and have resources available, drug overdoses and suicides. I'm going to say something about suicides because we've talked about it in the past. We are seeing the highest number since 1941. So there's more that we need to do, both from a healthcare perspective and public health.
During COVID?
Yes, absolutely.
Oh,
so it's a national health crisis. Mental health is, as well as suicide.
Wow, that's really... How long do you think it'll take before we get back? Do you think it'll be like a year-by-year thing, like baby steps?
Yeah, because we still have to focus on mental health issues as well as drug overdoses, which are big causes that are driving some of this variance too. All
right, so you were just talking about COVID, and let's talk about these interesting uptick, a major uptick in China with RSV cases or respiratory cases. Specifically among children. The hospitals are pretty much inundated with this, but we don't know too much, right?
We don't. It's a little mysterious. The WHO is keeping a close eye on this rise in respiratory cases, especially in children in China, like you mentioned. Chinese health officials maintain that this is primarily driven by influenza and other known respiratory pathogens.
Right.
But Erica, if you look at what happened before COVID-19 as well as SARS a few decades ago, there's always a rise in pneumonia-like cases, respiratory cases, illness, before there's a diagnosis of, are we dealing with a new virus that is causing this? So it's still early days, but we need to keep an eye on that. And then folks, as we head into the holiday season, folks need to keep those common sense measures in mind that have helped us throughout the course of the COVID-19 pandemic.
Yeah, and the Chinese government always not forthcoming with information. Hopefully we can get a little bit more in the coming weeks and months.
Right.
All right, so we are heading into the winter season, which can be tough for a lot of folks. It really takes a toll on our mental health. What should we be mindful of?
Yeah, if you notice a loved one, for instance, a change in their usual habits, if you notice a change in sleeping pattern, energy levels, it's time to seek some help. Whether it's your provider, whether it's calling one of the hotlines, national hotlines such as 988 that are available for help, it's important we keep our focus on mental health.
Right, and be proactive in checking on relatives or friends who maybe you notice a difference in their attitude.
Being more socially active always helps, even though the weather is colder and the inclination is to stay home.
Right.
But that
you don't
social...
want to go outside because it's so cold, but you really have to kind of make yourself.
That's right, absolutely.
All right.
It's very helpful.
Dr. Hussain, thanks so much for being with us.
Thank you for having me.
Always appreciate your time and your insight.
Thank you.
Really important stuff.